So we use all these equipment. So a typical ICU patient might need a ventilator, a catheter goes into their neck or somewhere else that gives them medications for effectively life support and sedation. So we use the ventilator, we use all the drip machines. We may use some advanced modalities as well to keep the heart going, dialysis, all the monitors, all the rhythms, everything. We use it to titrate up and down to make sure the patient gets through whatever acute illness they're going through and get them back, hopefully the way they were. If things don't communicate to each other, the gadgets, the ventilator, the monitors, the drip machines don't communicate, you have to do it yourself. It's very easy to make mistakes. It's also time consuming. So instead of taking care of the patient and thinking about how do I get this person better, you're worrying about the other things that you don't want to worry about. And I think having an integrated system where everything's taken care of for you gives you the time to take care of patients. You want that environment where everybody's working together, and I think we have that here. Having this system allows you to be more efficient, to spend more time taking care of patients, less time documenting, less time worrying about how this system works or that system works. I used an example with you earlier where I just finished doing a sedation on a patient that was almost 3 hours long, and I didn't have to sit down and check off their vitals every few minutes. I just did what I had to do, and at the end of the procedure, I just clicked one button that took all the data for that 3-hour period and plopped it into a note, and I just signed it. And the fact that I could just do that and not worry about all that, that's key.
So smart hospital and interoperability is a very tricky thing. And it's been a bit of a learning curve for us as well. This is, I think, where truly that solutions-based approach comes to light and not the transactional approach. This is where truly we need to be able to work out everything from beginning to the end. We need to map out all of the different workflows, connection points where systems will need to talk to each other, people need to talk to each other, and this is where that solutions-based approach comes into play.